Hello, and welcome to the Smart Injury Doctors Podcast, the injury market's top program for doctors, lawyers, and insurers who want to gain greater insight on how to improve patient recovery results and deliver better services in the U.S. injury market. Please welcome your host, Dr. Jeffrey Allen Kronk.
Hello, doctors, and welcome to today's program. Today's topic may seem a little bit controversial, but it's not. What I want to talk about on today's podcast is why don't chiropractic schools in the country, in the United States, actually teach their students how to do a standard spinal injury evaluation? Now, that's not being taught in a standard spinal evaluation is not being taught in any chiropractic college in the country that I'm aware of. Now, it's also not being taught that I'm aware of in any osteopathic college. It's also not being taught in any medical college. So it's not just chiropractic, but if chiropractors are the spine specialists, my profession are the specialists in the spine, and the trauma to the spine is the number one cause of chronic pain and disability, and it's what the market needs the most of. It needs experts in this particular area. Why in the world would the chiropractic colleges not teach standard spinal injury assessments? Why would they not teach their graduates coming out of school, their doctors of chiropractic, how to determine the severity and location of a simple ligament injury? But that's not being done today. So they're not being taught about the fact that there are two ways to image a ligament injury depending on what ligament is damaged. If you have a disc herniation, you're going to use obviously an MRI. There's 220 specialized ligaments that hold the spine together. If you have damage to the supporting ligaments around the disc, those are shear force injuries, and they cause excessive motion in the spine. And the excessive motion in the spine is how you determine the severity and location of the actual ligament injury. So if you have a C4, C5 motion unit and you have severe excessive 3.9 millimeters of translation, back and forth movement due to the supporting ligaments now being damaged due to the trauma. And at 4 and 5, we know that the fifth cervical nerve exits, and we know that that would cause a possible motor problem. So we would have possibly a deltoid muscle weakness. We would have the lateral side of the arm either hyper or hyposensitive, right? If we want to check that dermatome. So if we know where the C5 dermatome is, we know what to check. If we know what muscles are involved, and we can test for the particular level. Now, for an examination procedures and we have a hypersensitivity or a hyposensitivity at the C5 dermatome, and we have a C5 muscle that's testing weak, then we should immediately know, wow, what's the C4, C5 motion unit like? That's the main motion unit. It could be the one above or the one below that as well. But what is that damaged? If it's damaged, the ligaments are damaged, you're going to see excessive motion. If there's excessive motion, how much excessive motion is there? Is it mild, moderate, or severe? Because if we have excessive motion that causes a motor, sensory, or pain problem, we have, in the old terms, clinically, a chiropractic subluxation, which means misalignment or misalignment pattern, mismotion pattern that causes a nerve condition. It's also called a spinal instability in medicine, which is excessive motion that now causes a motor, sensory, or a pain problem. And it's the easiest thing in the world to do a workup on. It's the easiest thing to image, and it's the easiest thing to standardize in injury practices across the country, but it's not being done. And it's not being done. I've done other podcasts on the fact that 90% of the patients out there that are in chronic pain do not have a pathoanatomic cause. We have experts like William Morris, the head of the Ohio State Biodynamics Laboratory, who's one of the most researched, or who's one of the largest researchers in spinal biomechanics and spinal pressures in the world. And he writes a book called The Working Back System, where he's trying to help solve the problem of low back. Lumbar spine is the number one cause of disability, lumbar injuries. Cervical injuries are the number 4, and cervical injuries also lead to the number 6 leading cause of chronic pain and disability, which are headaches. So he says there that in his book, he cites 8 out of 9 or 90% of the patients who have a low back disability do not have an exact pathoanatomic cause identified with the doctors that basically are treating the patient. Now, that's a huge expense to workers' compensation. If I'm out there and I'm a Haven Healthcare, the group, Amazon, Jeff Bezos and Berkshire Hathaway and JP Morgan came together to form a company, and part of that company's job and it's a great company, again, called Haven Healthcare. You can look it up. And their job is to reduce costs in the market for their 1.2 million employees. Now, what do they do that's nice is they're also exporting anything that they learn to anyone. It's kind of like an open source company where they're giving whatever they learn to anyone in the market. So, one of the things that is needed in the market itself is the simple understanding of how to determine the severity and location of these ligament injuries that are so expensive to the employers. So employers should be demanding, look, if I'm going to use a doctor of chiropractic, they need to know how to do a standard examination for these types of injuries. If I'm going to use a medical doctor, if I'm going to use an osteopath, then they need to be able to understand standardly how to work up these injuries, because it's the misdiagnosis or the undiagnosis, the lack of diagnosis. Remember, if you're going to change something, you have to get down to the cause of what it is before you're going to get really great results in changing it. So if you don't know what the injuries are, and doctor, if you're listening to me right now out here today, you were never taught. You were never taught how to determine the severity and location of a simple ligament injury, and it's not just writing a cervical sprain down on a diagnosis code. For somebody today to say, well, this patient has a cervical or a lumbar sprain and that's their diagnosis, that's like somebody having a leg injury and having the doctor say they have a lower extremity sprain. The first thing anybody should be asking is, well, where is the sprain? Where is the ligament injury? How bad is it? And where is it? So if you had a leg sprain, you'd say, well, where in the leg? Well, in the knee. Good. In the knee, how bad is it? Well, it's a grade 3 sprain. It's a grade 3 ligament problem. And this is how I identified it. This is how we imaged it. This is what we're doing to treat it. The first step to great injury results, I don't care if you're an employer listening today, you're Haven Healthcare listening today, you're a doctor listening today, the first thing that has to occur in order for you to get good results, or if you're a patient listening today, get good results, is you have to identify the severity and location of the injuries. And we have to be able to do that standardly. Right now, in this 60,000, 80,000, 90,000 chiropractors that are out there, my colleagues, none were trained in a 1-year, 6-month program on how to determine the severity and location of a simple ligament injury, that injury that causes the most amount of problems in the market today. So if you're a student today at a chiropractic college, you should be asking your educators why they're not teaching you that. That'd be like dentists coming out and not knowing how to locate the severity and location of dental decay, of tooth decay. Of course, when you go to dental school, you're going to be able to determine the severity and location of dental decay, of tooth decay. So why in the world would you be in a healthcare market, in a healthcare educational program today, and not know the severity, how to determine the severity and location of a spinal ligament injury? It just blows my mind that that's occurring. It occurred for me. I graduated from Palmer College, one of the oldest colleges in chiropractic in the country, and I graduated in 1988, and I was never trained how to do it. And I know to this day, when I ask students that are coming out of all of the chiropractic colleges and just say, okay, simply tell me how to determine if a ligament is damaged in the spine. Remember, the spine is the main thing that doctors of chiropractic deal with. If ligament damage is the number one cause of pain and disability in the world today, how do you determine the severity and location of a patient that's just injured their ligaments? How do you know where it is and how bad it is? And if you don't know where and how bad, how are you going to get successful results with it? And if you're getting some successful results with it, think about how much more successful you could be if you knew the severity and location of the condition and you were trained in it and you were taught in it. That would change the environment in the United States. Chiropractic, my profession is very small. When groups do research, the research of the market's about a $14 to $15 billion market. It's a very small market. That's less than 0.0. It's like a third of 1% of the total healthcare dollars spent are spent in the profession of chiropractic. So it's very, very small. It represents less than a third of 1% of the total healthcare dollars spent. Now, that 15 billion in medicine, back problems, low back problems in 2010 were at around $253 billion. But the medical doctors in the market today, and take no offense to this, you weren't trained either on how to determine the severity and location of a simple ligament injury, so it's not occurring in the medical market either. And it needs to be occurring with every doctor, because the more that you understand and the more quicker you are with an accurate diagnosis, the more you can use conservative care procedures that are highly successful for this particular condition, so that you don't have to have patients that go long-term and suffer from long-term chronic problems that they wouldn't have had to suffer with. And that is devastating to them emotionally. It's devastating to them financially. It hinders their ability to work. It hinders their ability to be successful in their family and to participate in lots and lots of things. And it doesn't have to be that way, but we have to get much better. And the only reason why I bring this to you, is if you're a doctor listening to me today, is to bring it up to your colleges. I brought it up to my college. Bring it up to your college that this should be a standard trained procedure for the chiropractors to come. I'm specifically talking to the chiropractic profession. If you're a student listening to one of my programs, you're listening to this program today, ask your college, ask your professors, why aren't they determining the severity and location? Why aren't they teaching you how to determine the severity and location? Remember, you can't misalign a spine. You cannot have a hypolordotic cervical spine or a reverse cervical curve. You can't have PLR-C5 without ligament damage. So you ought to understand about ligament damage if you're going to be treating these things. It's particularly important in the injury market. And doctors, if you're listening out there today, good. If you haven't learned how to determine the severity and location of a simple ligament injury, I'm going to say it again on this program today. That's what the Smart Injury Doctors program is for. You go to www.smartinjurydoctor.com. We're creating a group of doctors, whether they're chiropractic doctors, if they're medical doctors, osteopaths, it doesn't matter. If you want to come in and you want to learn about ligament injuries, that's the group. That's where we are training doctors to have that level of understanding. You should have gotten in your basic training, so should have I, but it's not there. That's why we have to get it outside of our formal education. Doctors, like always, these podcasts are short and to the point. If you've got any comments for me, please comment down below. If you've got any questions, concerns, or you have anything that you want me to talk about on future podcasts, please put the comments down below. I check them out, and that's how I come up with the topics I come up with. These are short, sweet, and to the point. Doctors, I look forward to seeing you on the next podcast. Thank you very much.
You've been listening to the Smart Injury Doctors Podcast, the #1 audio production show for professionals in the U.S. injury market that want to deliver better injury services to the patients, clients, or insureds they serve. If you like what you heard today, please leave us a review and don't forget to join us on our next program.